Welcome. This is the Dentist News Network. I'm Scott Drake, and my guest is Dr. Brian Harris with Harris Dental in Phoenix, Arizona. Brian, good to see you again.
Thank you.
This particular conversation is going to be regarding porcelain veneers. So what are porcelain veneers?
Porcelain veneers are essentially a thin piece of porcelain that sits on the front of the tooth and is actually bonded to your natural tooth structure. Once it's bonded, it stays put. You know, it's what we call a permanent fix to change shape, color, size. You know, essentially anything related to the looks of the teeth, and actually in a lot of cases we can add strength or build back parts of the teeth that have been worn down through excessive wear or through bad habits over time.
And how long do the veneers last here?
It's a question we get on a daily basis, and the answer is nobody really knows. The procedure has probably been around coming up on 20 years now, and so as a safe bet, I try to tell my patients 15 to 20 years, but we're going to see these things last much longer than that. There's no reason to replace them unless they break, unless you get a cavity underneath them, or unless you just want a brighter color. So as long as they're taken care of properly and cleaned on a regular basis and flossed, they could last a lifetime. It just kind of depends on each person and how well they take care of their teeth and their oral hygiene.
So I assume you have to prep the tooth in some way. Can you talk about the process?
For a traditional porcelain veneer, a thin layer of enamel is removed on the tooth, and that's typically done to create room for the porcelain so they don't look too bulky, so they don't look fake. Now, in the last 5 or 6 years, something that's become very popular is the idea of a minimal prep or a no prep veneer. And we use those in a lot of cases where patients have straight teeth, maybe they just have spaces, or maybe the teeth are tilted more towards the back of their mouth. And it allows us to essentially build on top of those teeth without having to take away any enamel or any tooth structure. And we can get some really good natural results with those if they're a candidate for it, and not everybody's a candidate for that. If they're not a candidate for the minimal or the no prep veneers, then a little bit of enamel is removed to create the desired effect.
Compared to other options in treatment, what are the benefits of porcelain veneers?
I like the veneer personally because it's typically a more conservative option. A traditional dental crown, you have to reduce the tooth all the way around and on the top of the tooth also to make room for porcelain to cover the entire tooth, where a veneer is more of a superficial covering just on the front aspect of the tooth. So it's a more conservative procedure, allows us to still get really great results, very natural results with being more conservative and taking away less tooth structure.
And how much do veneers typically cost?
Cost, I would say it's kind of a wide range, but you can find a veneer for as cheap as $800 and go all the way up to $2,500 per tooth. And a lot of that depends on the location, you know, where you're living. A lot of it depends on the experience level of the doctor. I would say most of it depends on the type of laboratory the doctor is using. You can have a veneer made for relatively cheap, or you can pay a lot to have a nice veneer made by a dental ceramist that looks natural, blends with the rest of the mouth. So a lot of it just depends on the quality of the veneer. Just like any other product or service, you're gonna get what you pay for.
All right, Dr. Harris, thank you.
Thank you.
You can find out more at dentistnewsnetwork.com. I'm Scott Drake. Thanks for watching.